Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about Penn Foster for medical billing and coding training. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, first things first, disclaimer first. I have never been to Penn Foster. This is not an ad for Penn Foster. I don't know anything about their particular curriculum. All I'm going to read today is what is from the Penn Foster website, and I'm going to explain some things in case you may not really quite understand. This is not an endorsement for them in any way, all right? I did a similar video for Ed to Go, only because I get a lot of questions about particular schools. Guys, keep in mind, I have never been to these schools. And so that's the thing that's kind of stopped me from really saying this or that about a school. Penn Foster is one of the ones that a lot of people say that, oh, you know, my employer will pay for this, or I'm in a certain program and they're willing to pay for Penn Foster. Is this a good program? I will say this also before I get into the whole episode. Medical billing and coding programs like this are very self-directed, meaning that you are not going to have somebody that's going to be an instructor that's hands-on with you. You are going to have to learn this on your own. That is the way a lot of medical coding schools are. And there's a lot of people who get really upset and mad when they start because they're thinking that they're going to have somebody to kind of help them and guide them. You can find help and guidance through finding mentors or, you know, finding a tutor. There's a ton of tutors on LinkedIn. I'm a tutor myself. My rate is in the description box below. But that's something that you have to keep in mind. It's not always going to be the way that you think it is, but it doesn't necessarily mean that it's bad. What it means is that if you pick this program for your training, that you are going to have to work through it through thick and thin, whether you like it or not, whether it makes you mad because you feel like they should help me more, or, you know, whatever the case may be. This is when you're going to have to dig deep. You're going to have to go through those uncomfortable feelings of uncertainty, and you're going to have to push through. It's going to make you a stronger medical coder. We all went through this. Us as medical coders who have been in this industry for more than a minute know what it's like to learn on our own. We always have to go through this, unfortunately. And so, like I said, there's a lot of these fast-paced medical coding schools. This program is not particularly fast-paced, which I like. That's a plus for them. Okay, I will say that is a plus for them because they are not pushing people to be done in like less than 6 months, all right? They're saying that the fast track is 11 months, and if you're taking a little bit more time, 15 months. Hey, that's great. To me, when you are encouraging people to get to the material, but, you know, take their time, but really kind of understand what's happening, you know, that's a great thing. So I'm going to leave this link for Penn Foster in the description box below. If you want to check it out, by absolutely all means, go ahead and see if this is for you. Some people will say, well, Blue, I need this because it's going to fit into my budget. Okay, then you're going to have to work with what you're going to get, all right? It's not impossible to teach yourself. It is quite possible. But some people just kind of get overwhelmed when they don't kind of have a direction, which is why I've put out my independent study video. I will leave that link in the description box below to kind of give you some kind of like form of reference, like, okay, like how can we get started here? What should we get going on first, all right? And it lists everything in order. It gives you the roundabout time that you should go through each subject. You know, it's just something to kind of give you a guidance, all right? So go ahead and let's just get started, all right? Okay, so reading from the Penn Foster website, this program is about $1,200, right? And it trains you for medical billing and coding. It says here, if you want to work in the healthcare industry in a role with the option to work from home, of course, they got to sell that part there too, you can pursue that passion with Penn Foster's online medical billing and coding career diploma program. Study with the support of helpful instructors and faculty. Enjoy a program that offers engaging visual learning aids and interactive assessments that will help you practice as you go. I'm going to stop this right here. So because of my channel, I've heard from many people who have gone through Penn Foster. And they do say here that they will have helpful instructors and faculty to help you. I have also heard the complaint that there are a lot of people who will write to their instructor and will not hear anything for weeks. So keep in mind that I don't know what the student load is per instructor, or how many instructors they have, or how it's broken down. But keep in mind that sometimes you are not going to get an immediate response if you go through this program. That's something that you need to know, because a lot of people will get to that point and then get really mad. And I'm the one who gets the emails from people that are really upset with, why does this happen? These are programs and this is a business. So again, you're going to go through these things where people are going to tell you things that you want to hear. That's why I keep it real on my channel, guys. I tell you the things, and sometimes it's things that y'all don't want to hear either. I know, because I get those comments too. But that's okay. I'd rather be honest with people, because we're all adults here. It's no need to sugarcoat anything when it comes to, this is going to be your investment in yourself, okay? So moving on, it says, Penn Foster's Medical Billing and Coding Career Diploma program helps you prepare to sit for your CCSP, which I do not recommend. They're going to give you a voucher to sit for this. But again, guys, I challenge you to look at the job listings and see, does anyone ask for this CCSP? No, they don't. You'll see in many areas that they do not. Now, before any of you comes on here and tries to come for me in the comments, I'm going to tell you this. If you look in the major cities, they are looking, when they're looking for medical billers and coders, they are looking for them to have AHIMA certifications, the American Health Information Management Association, or AAPC, the American Academy of Professional Coder Credentials. These are the two major ones that they're looking for. To me, if I'm going to spend any time doing anything or studying for anything, it needs to be for a purpose. So I'm not going to waste my time on something that's not being asked for. Yes, there are some people out there who have this who did not know. If you didn't know, you didn't know. I mean, there's just things that, just happen. You don't know. And they say, oh, it's part of the program and you get this free credential. And you think, oh, this is a great deal. Well, guys, think about that, right? If they give it out for free, is anyone asking for it? Okay. So the other than that, it does not come with a voucher for testing for AHIMA or AAPC credentials. Some programs do, not this Penn Foster program though. The only one that it comes with a voucher for the certification is for the CCSP. And again, no one asks for it, so you don't really need it anyway, in my opinion. All right, this is just my opinion, okay? It does prepare you to sit for the CPC offered by AAPC. It does prepare you to sit for the CCA offered with AHIMA. Now, when you are going to sit for either one of these and you're trying to decide, should I go with AAPC, the CPC, or should I go with the CCA? Keep in mind this. The CCA covers inpatient and outpatient coding. It requires you to know the ICD-10-CM, obviously, but it also requires you to know the CPT manual and the ICD-10-PCS manual. You got to know all of these, all right? And with the CPC, you just have to know, of course, ICD-10-CM and the CPT manual and the HCPCS manual. That's all you need to know, all right? So that's just outpatient side. There's different rules for inpatient and outpatient coding, but if you're going to sit for that CCA, this is a very powerful credential no matter what anybody says, because I had this. This is what started my career, and I had it for 13 years. And trust me, I'd still have it today if I wasn't doing other things in the background. But because of that, I had to put it to bed. But I will always advocate for the CCA, because people who have the CCA, while it says entry level in the description of that credential, it means that you know and that you are competent to code in inpatient or outpatient settings. So this is going to give you more of an opportunity to apply at a lot of different places, not just outpatient positions, right? It's going to allow you to apply for inpatient positions as well. So that is something that if you are considering this program and you're thinking, which one should I go with? If you want to go with AHIMA and you want to go with that CCA, that is something that you're going to be able to apply at more places, because again, you know how to code inpatient and outpatient. And this is going to train you in both, okay? So just something you got to know. Penn Foster will also provide students in the program with a voucher to cover the cost of the CCSP. Again, you don't need it. Medical billing and coding professionals are paid a competitive salary. We never talk about specifics on my channel. You can do your research in your area, because every area starts their medical coders at a different salary rate. But it is always good anyway. I'm just saying. It says our online programs are flexible enough for you to finish them at a pace that works for you based on how much time you are able to dedicate to your schoolwork each week. And then it says you will learn how to apply CPT, ICD-10. If they say ICD-10, they didn't specify CM and PCS, because you do have the choice of, while you're in this program, and maybe you get to the end part of it and there's PCS portion by itself. If you are going to pursue the CPC credential, I mean, obviously you don't have to study the PCS side, because again, that has nothing to do with the CPC, which is just all outpatient. If you wanted to go with an AHIMA credential, and even though it doesn't say that it prepares you for that, you could certainly sit for the CCSP, which is the AHIMA's outpatient medical coding credential. So like the CPC is just outpatient for AAPC, the CCSP, the Certified Coding Specialist Physician Based, is all outpatient coding for AHIMA. So, you know, it's going to require you to know ICD-10-CM, CPT, and HCPCS. Same thing as the CPC. So you have your choice there, even though it did not say. It's another credential that you could potentially sit for, all right, if you're interested. And HCPCS coding guidelines to identify diagnoses, procedures, and patient medical records, how to identify the procedures for medical record retrieval and reimbursement, how to explain the role of a medical coder as a liaison between the health clinician and billing offices, and how to apply computer and information literacy skills using electronic health records software. And then it tells you on the website how much the average is for a medical coder to start, all right? And then it says, I'm going to go to the full curriculum here, but it says that it's 11 courses. It is 40 exams. There is 75.1 CEUs. Now, you're not going to be able to use these CEUs towards your credential when you get it, all right? So that's just something that you got to know. But I think that they mean CEUs for their, for completing their program, for them, not for the associations, all right? So if you're thinking that you're going to be able to knock out getting CEUs before you get your certification, that's wrong. You cannot get any, or you should not get any continuing education units until after you've gotten your certification, because that's when the clock starts. Anything that you earn prior to getting your certification does not count, all right? You can call the associations if you want to, and to verify that, but it's true. Anything that you earn needs to be after the date that you got your certification, because that's when it starts. That's why you see for AHIMA, they have the student membership, and it says that there's no CEUs that you can earn with that, because again, you don't need them and you're still a student. Just saying, all right? Four submitted projects are also included in this. The estimated completion time fast track is 11 months. Again, I say that that's great, because 9 months, 12 months, or 18 months is what you should look at for completing a program. And it doesn't matter if you come from a medical background. Okay, again, 9 months, 12 months, or 18 months. This is what I recommend, all right? Because it's so much. But they say fast track is 11 months, so that's good. Average time is 15 months. Again, that's respectable. It's understandable, because there's so much for us to learn. With Penn Foster, you can learn at whatever pace works best for you. And I recommend that you work 20 hours a week on that schoolwork. And if you say, well, no, Blue, that's too much, I do 40 hours a week. I'm just trying to set you up for success. If you're really serious about this, you will find 20 hours to do your schoolwork. Some learners are more comfortable moving faster and dedicating more time. The fast track estimate will apply to them. The average track will apply to most learners who can dedicate a few hours a week to completing their schoolwork. So now I'm going to read from their full curriculum that they will train you on. Introduction to Allied Health, and that's going to cover identify skills needed to be confident and independent online learner, and then explain the standard knowledge and skills required for healthcare careers. Then you'll have medical office procedures. That's going to help you to learn how to apply knowledge of basic arithmetic skills to complete math-related tasks in an office setting. Now, before you panic, because I know I heard some of you just panic just now because I mentioned math. It is not that bad. It is plus, minus, multiplication, division math. It is basic math. It's not algebra. It's not advanced calculus. It's not anything that you can't do on a calculator. Okay, guys? This is very basic math. Do not let the math portion scare you. You don't have to be great with math. You just have to know how to do plus, minus, multiplication, and division math. Basic math. And you should be able to know how to do that, especially working in this industry. That is a must. There is no getting around that. You have to know that. Identify how to create professional business correspondences, which is very important. Recognize effective communication techniques in an office setting. Again, key importance. Describe how to use Word and Excel to complete business-related tasks. Word and Excel are very easy to learn once you get to learning them. And if you say, well, no, Blue, I'm scared of the computer. You can't be scared of the computer, honey. Not with this business. You have to be comfortable with using computers. If you are not comfortable with using computers, give yourself some time and give yourself patience to learn how to use it. Because again, that should not stop you from a career. I'm just saying. The next subject is Body Systems and Medical Terminology 1. Define medical terms and regions and structures of the body by analyzing medical terms. Identify anatomy, physiology, diseases, and treatment of the cardiovascular and hematologic systems. Identify the anatomy, physiology, diseases, and treatments of the respiratory and endocrine systems. And then, of course, of urinary and reproductive systems. And that's covered in Part 1. Part 2, Body Systems and Medical Terminology 2. This will help you to identify the anatomy, physiology, and diseases and treatments of the integumentary system and the musculoskeletal system, the sensory and nervous system, and the immune system. Then you have pathology and pharma. Describe 4 subdivisions of pharma. I'm saying it because that's just the way I gotta say it here. Next, being able to identify different classifications, including vitamins, minerals, which a patient may take for a variety of health conditions. Explain causes of infection, diseases, and techniques used to stop the spread of infectious disease, and the etiology of common diseases and conditions. And then you have your electronic medical records course. Of course, that's going to go over the EHR, and then like they do a simulation chart as well in here. Then you have medical billing and health insurance. So you're going to discuss various reimbursement methodologies and payment systems, and then define health insurance. Law, ethics, and confidentiality in allied health. So interpret civil and criminal laws related to healthcare. Assess ethical issues healthcare professionals face today, and then analyze confidentiality laws and regulations, so basically HIPAA. And then you're going to hit your basic medical coding. So you see how you have to build all of that knowledge before you get into the coding portion? It's very important to build yourself up to these certain topics, because if you just try to jump into the coding, it's not going to make any sense, and it's going to send you running for the hills faster than anything else. So at the end of this course for basic medical coding, you will describe the layout and the purpose of the ICD-10-CM manual, explain how to use the ICD-10-CM to assign codes for medical diagnoses, summarize the guidelines for coding physiologic conditions involving different organ systems, identify the purpose of the ICD-10-PCS and how it is used, and then assign diagnoses and procedure codes using the ICD-10 coding manuals. Now, I will also say this: if you decide to go with AAPC and you want to go with the CPC first, and then you say, well, Blue, I think I want to do the inpatient test as well, the CIC. That is okay. That makes sense to me, and you don't have to wait 2 years in order to do that. Why? Because the CIC is completely separate from the CPC. This means that you know how to code inpatient. And this program is teaching you how to use that PCS manual, the ICD-10 PCS manual. So again, if you want to do that later on, if you want to continue studying independently for that, on the PCS side, for that CIC credential, that's okay. You can do that, because there are some employers who ask for the CIC. And I think that that's great, because that makes more sense to me than piling on all these other credentials that are already covered with the CPC. Okay, the CIC is not covered with the CPC. So that's why I say, if you're going to stick with AAPC, that's a good way to go. I'm just saying. Let's see. And then it says assign diagnosis and procedure codes using the ICD-10 coding manuals. So it may be a combination of the inpatient coding and then the diagnosis coding as well. And then intermediate medical coding. At the end of this course, you'll be able to assign codes for services and procedures using the CPT and HCPCS Level 2 manuals. Outline the procedure for assigning codes for the E&M and anesthesia sections of the CPT. And then outline the types of services and procedures described in the CPT. Explain the types of procedures coded in the HEMIC, lymphatic, digestive, reproductive, and urogenital systems. And then describe the procedures coded in the endocrine, nervous, ocular, auditory, radiology, pathology, and medicine sections of the CPT. And then assign CPT and HCPCS codes for physician procedures and services. And then you have the final, which is the billing and coding professional certification review. At the end of the course, you'll be able to describe the anatomy, terminology, and pathophysiology of various body systems, code rendered services using the CPT manual, explain the use of the HCPCS codes, code diagnoses from the ICD-10 CM manual, assess your knowledge on medical coding by taking a sample certification post-exam, and then demonstrate mastery of medical coding by completing a sample certification exam. So that's what's covered in the Penn Foster program. Again, this is very self-driven. Even though they say that there are instructors available and faculty, it does not necessarily mean that they're going to be there at your beck and call. You have to be prepared to learn on your own. There are plenty of medical coding tutors out there. I'm a tutor myself. My rate is in the description box below. And one more thing to wrap this up. If you are looking to get into a study group, I do have a study group that is available to my Patreons on my Patreon channel. The pledge begins at $10 per month, and those funds go to funding my education. So that is something that is also available, and that link for my Patreon channel is in the description box below. There's access to tons of puzzles and coding quizzes and word finds. So if you're looking for extra supplemental education or getting involved in that study group, that is something that is also available if you are interested. So I'm going to wrap this one up. Thank you guys so much for joining me. If you studied today, leave me that blue heart, and I will see y'all the next time. Please like, subscribe, and share, and I'll see y'all again. Bye.